The Evergreen Media Network Studio, powered by Scott Tree Services.
Hi, welcome to Silver Linings. I'm your host, Janean Barrows, and today we have the pleasure of having Dawn Redstone here in the studio with us. Dawn is going to be representing the Senior Collaborative of Indian River County, and she is their executive director, and she is going to give us a bit of education about who they are and what they do and how many lives they touch here in Indian River County. So, Dawn, thank you so much for joining us.
Thank you for inviting me.
I am very lucky to have you for your time this morning.
Thank you.
And I realize that. So tell us a little bit about yourself, how you ended up in this very important role, and then about Senior Collaborative and what their mission statement is and their goals for serving our community.
So the Senior Collaborative has been around for about 6 years now. I was on the board of directors for a couple of years prior to accepting this role. My background is a little diverse. I spent many years with the sheriff's office and worked there for a number of years, and then went into healthcare after that in a variety of roles, but worked with senior living for the last, say, 10 years and a little more. And I was on the board of directors, and I moved into this role a year ago.
Yes.
The Senior Collaborative was
An important role at that.
Yeah, it's an important, and more than I thought it was going to be.
Sure.
I was one of the gentlemen who started the Senior Collaborative was Randy Riley. He, through some personal things, found that there was really not a conduit or a one place that people could go or people could call to get information on senior services in this county. We have lots of great organizations such as Senior Resource Association and Alzheimer's Parkinson's Association, hospitals, the PCCH and Whole Family, and the many, many, many healthcare communities and ALFs. But there was no one place that was kind of the hub to be able to give that information to those who sought it. So he, along with Peggy Cunningham with United Way, he was the retired CEO for them, and Karen Deagle and a few other community members put together the Senior Collaborative. The mission and the goals of the collaborative is to serve the seniors of Indian River County, to have a place for people to call, to go, to find out what services are available for them. Literally, we average about 1,200 clicks, essentially, on our website monthly.
Monthly.
People looking,
Wow,
it could be
that's a lot.
seniors themselves, their families, their neighbors, agencies, people looking for every kind of service that there is for seniors. We average around 30 calls a month, also from individuals. And the individuals can be from other parts of the country, literally, and looking because they've got family members here in Vero. They ask information about everything from, do you know somebody who will change my light bulbs? To, I need transportation, to, I need 24/7 care for my loved one who lives in Indian River County.
Right.
It literally goes the full gamut. Our website is seniorservicesirc.org. It literally, we have members of the collaborative. They are from the not-for-profit world and the for-profit world. And so if someone goes onto our website, they can click on a part where they can put in keywords. So if they're looking for somebody to change their light bulbs, you may be looking for a handyman,
Right.
or you're looking for somebody does air conditioning work, or you're looking for someone to provide in-home care. So they can put in different keywords, and it'll pull up information on agencies or organizations that provide that information.
Kind of like a yellow pages of services.
Kind of like a yellow pages, because they can go directly. They can go from the website to the link to the organization. For instance, if they're looking for a hospital, and Cleveland Clinic and New River Hospital has a page there, and they can go to their link to find out different services that the hospital offers.
Nice.
Or if they're looking
Very
for
convenient.
private duty, they can do the same thing with that. Or rehab, they may go to Encompasses. There's just, if they're looking for a physician, I mean, we have it all, essentially.
Hold that thought for a second, because you've piqued my interest a little bit. We are talking about our senior population services, but you also reference the reality that you get mostly clicks on the internet, on the website, people seeking information, following through from one page to another, and getting and gathering their information that way, and less in number and the physical calls. Do you see that our senior population has become more internet savvy, or are these more their children utilizing that internet service to garner and gather information?
We certainly have a population, not just seniors, that are not computer savvy. So a lot of the clicks, as I'm calling it, or the people seeking the website, are people that have a rudimentary knowledge of how to use it, and it may be their family, friends, or neighbors. I've had a couple of folks that I've talked to that they get their grandchildren to help them.
All right. No, that makes a little more, it piques my curiosity, because I thought that's a really large number of individuals utilizing the technology aspect.
We've had as many as, we've had 1,800 in a month.
Wow.
But it kind of depends. There's some seasonality about it as well. Of
course, we live in Florida.
We live in Florida, and so there is that. But it's interesting. We do get people that call or that are interested that are from other parts of the country as well as other parts of the world, because they have loved ones or family in this area. We used to do a lot of, and we still do sometimes, a lot of radio advertisement for the collaborative, as well as for some of our projects that we have or some of our programs we have. And
they tend to be some of the bigger listening demographics.
They are.
Presently. A lot of younger people don't listen to the radios, but those over 50 do now. They're very focused on it.
You'd be surprised. But because the radio stations that we advertise on go into Brevard County and also into St. Lucie County, we get calls from there as well. We primarily work just with Indian River County residents and their families. However, if we receive a call from out of our county and we can help guide them to the right folks, we certainly will.
Oh, well, I'm glad to hear you're not like, not my job, click.
No, we don't do not my job, click.
I'm glad to hear that.
We try and help as much as we can.
So I interrupted you. I apologize.
You're
and
fine.
I know you were on a flow. If you wanted to continue, I'm sorry.
No,
I got
you're fine.
sidetracked by the technology and the interaction of our senior population.
We, a couple of years ago, we took over running the Senior Expo, which we do annually. And this year was in March of this year. We had a little over 600 people that attended, and we had 92 vendors. And then we're already in expo mode for next year, which will be on March 20th of next year.
And you expect a significant jump in all of those numbers.
We
for
have
next year,
every time.
Mm-hmm. Yeah.
From the year previously, we had 529 vendors or 529 attendees and 66 vendors. So we've moved up.
Consistently growth. Yeah.
Yes.
It's a wonderful event. I was there this past year, and I was blown away by the amount of resources available and the inclination of those resources to interact with you, to talk to you about really what they have and what they can do. So if you're going to have a clear schedule next, February?
March.
Sure you go.
March 20th next year and it'll be the same as last year, except it'll be larger, which we anticipate. We had lots and lots of different kinds of health screenings going on as well.
Yes, I remember.
Free health screenings. Yeah. There were food trucks. There were, all kinds of different information that was shared. And it was a great venue to be able to, all my vendors and even the participants said they really gained a lot from it. Yes. They made great connections, as well as made the seniors and their families made great connections to find services for their loved ones.
Well, I know that the collaborative is much more than a place for a website or to get redirected to
Absolutely.
other resources. There's much more in-depth programming and
Mhm.
services provided by the collaborative. Now, Silver Linings has
Yeah.
some sponsorships, and so we do take a mid-break, and I'm going to go ahead and do that now because when we come back, we're going to delve deeper into those very programs, who they serve, and how people can go about utilizing those services.
Absolutely.
Thanks.
At Sunshine Furniture, our 35,000 square foot showroom is filled with the largest selection of in-stock coastal furniture on the Treasure Coast. Dining and bedroom sets, occasional tables, sofas, sleeper sofas, love seats, and chairs in all the latest styles and colors from Tommy Bahama, Lexington, Hooker, Riverside, Universal, Four Seasons, Braxton Color, and Capri. We're the outdoor furniture experts and have hundreds of styles of any patio furniture you need, including a gallery of Berlin Gardens, Hollywood, and Kingsley Bait. We specialize in fire bits, outdoor rugs, umbrellas, and replacement cushions. Right now, we're having a super summer sale with lots of great markdowns and discounts on everything you need for your Florida home, including all pictures, lamps, and accessories are half price. Sunshine Furniture, $12.95 US 1 in the Publix Plaza, Vero Beach. Don't forget to visit our outlet store directly across the street and visit our website at sunshinefurniturecasual.com.
Sunshine Furniture.
Welcome back to Silver Linings. We are so grateful for our commercial sponsors, but also grateful for our actual Silver Linings sponsors. And I would be remiss if I didn't say thank you directly. So I want to give a shout out to Conway Financial Planning Team here in Vero and to the Rooney and Rooney legal team here. Without them, we would not be able to bring Silver Linings to the Treasure Coast. On that note, we were talking with Dawn before break, and she was just getting ready to step over the edge and start talking about what services, programs, and individuals that utilize them are actually being offered through the collaborative.
So one of our major programs that we do is Upslide. Upslide stands for, it's an acronym, it stands for Utilizing and Promoting Social Engagement for Loneliness, Isolation, and Depression in the Elderly.
Wow, that's a mouthful.
It's a mouthful.
I like Upslide better.
Yeah, exactly. It is a program that was started out of the Tallahassee Community Center about 6 years ago, about 5-6 years ago. And it basically brings together a Friends Connection group. It's pulling people from the lonely and isolated seniors.
We see a lot of that.
We see a lot of that.
Yeah.
Before COVID, there was a significant number, but after COVID, it grew exponentially. So after COVID, they're saying in Indian River County, we have about 22% of our seniors are lonely or isolated.
I believe
If you think about it, when during COVID, we told everybody to stay home, and they did. Now they have to come back out. And some of these folks, their friends, their peers, their loved ones moved, passed away, went into facilities, whatever. They became more and more isolated. I can tell you, we started it here. Actually, Randy, my predecessor, went to a conference and met Melanie Lockman, who is the one who runs it in Tallahassee, and was just astounded by the work they do and how it's helping the seniors in their community. So he brought the program here along with Melanie. They were lovely enough to gift us their program. And so we have been working on it and started it at the beginning of this year, actually just before the end of last year. And we have a Friends Connection group that meets weekly, and they basically they get to know one another. They have activities they do. I'll tell you just a brief story about one of them. It'll give you a clue.
Okay.
Lovely gentleman. He had been married for many, many years. He and his spouse moved into a beautiful community in Indian River County. They had been there a short period of time. She came on one day and said, I haven't really loved you in a long time, And so I think we should divorce and you should buy me my own place. So they did, and he did, and he spent a good amount of time for the next 2 months in bed. He he didn't have a purpose. He didn't know what he was going to do. He was just very lonely and isolated. He came to the Friends Connection group, and he changed remarkably. He went from being a bit disheveled, not necessarily taking care of himself, to very fastidious, he made some great friends. He gets together with them outside of the group. He and one of the other ladies that is in the group went horseback riding on the beach. It's something they'd never done.
And so from complete isolation to adventure.
So he told me that he said the horseback riding was wonderful. The horses were slow. The horses were old. So it worked out really well for them. But he just, he's enjoying life. He is.
I give him hope and purpose.
Yeah, he's made friends, and one of our ladies in the group made a friend with a lady of a different culture, and felt that to be a better friend, she needed to research that culture so that she could be a better friend to this individual. And it's just the bonding that they're doing is great. Some of these folks have family that are spread out across the universe, and others don't have anyone. They have either outlived them or they've lost touch. And so this is bringing them into, getting them more socially active. Medicare did a study a couple of years ago that said that loneliness and isolation in seniors costs $6.7 billion annually.
I believe it because they're the number one people who call repeatedly to go to the ER.
They do.
And they're not necessarily acute in a scenario that would require them to be there. They're lonely. They get nervous and they're anxious about what could be or couldn't be. So I'm just going to go into the ER because those folks there are amazing and they're going to tell me everything. But it's not a great way to utilize our resources.
No, it's not. And the other thing they do is they don't take care of their health. They may not take their medication appropriately. They may not eat appropriately. So it cuts about 6 years off their life. It's like smoking a half pack of cigarettes a day.
Wow.
Which is, if you think about it. So that's one of the programs we do. It's a wonderful program, and we're wishing to grow it, of course.
That is a wonderful program. Very important.
It's facilitated by a licensed clinical social worker, which it's not a counseling session, but she's
oversighted.
She is amazing with them. The other thing we do is, as I mentioned earlier, we have the expo, which we do. We have an educational workshop coming up on trauma-informed care in the aging population. That's coming up in the end of July, and it is specifically for caregivers, whether they're professional caregivers or whether they're family caregivers, professionals, individuals that work with seniors. Trauma-informed care is something that affects not only children but adults. If there's many types of trauma that happen in our young lives, and some back in the day, we used to shove it under the rug.
Yep, suck it up, buttercup, right?
Suck it up, buttercup, and they, people didn't talk about things. So as aging happens and dementia comes in, or other types of things come in, sometimes these folks that the families had no idea that mom or dad had these particular traumas or PTSD from some action that happened, and some behaviors come out or some paranoias come out. And so this is a seminar, a workshop that will help them learn how to work with these individuals, how to respond to their actions and so forth, and in a healthy way, and to be able to care for them appropriately.
That's amazing. And is there a fee for this?
There is. I believe it's $28. It's a 4-hour workshop. Food will be provided and so forth. If somebody is interested, they could go to our website. It's called Trauma Informed Care and the Aging Population, and you can sign up through there.
They can register right there online.
Absolutely.
I think our producer, Will, has some of that information up. So
I think he does.
That's really great. It's easy and convenient to register, and then you can show up and you're going to get your meal as well and be filled with information on how to be responsive. I love that. That's a great program and a great service to our community for caregivers, for families, all the way around.
We have one other thing that's coming up, but it's not coming up until the end of September. We are going to have a senior dance.
Oh, I like that.
So many calls we get are from seniors looking for someplace to dance, looking for someplace to socialize. And they may not live in a community that has activities such as that. And so we are going to have a senior dance and it's the end of September, and it'll be at the Elks Hall. As flyers and so forth get put up, it'll be on our website, and you'll probably start hearing it on the radio and a few other areas. But we're excited to do that and to,
have some fun and
have
spread
some fun.
the cheer, right? And music is such an important part of our lives as well, and dancing. And I know a lot of seniors that just light up when you put on music that they recognize from their youth, that they were used to dancing and going to halls. And I remember Sadie Hawkins dances and things like that. So it's something that they will go out for and participate in. And the Elks is a great big location.
It's got a great
plenty
venue.
of space for people to come and park and attend. So that's something really neat. I'm looking forward to seeing some of that information and coming out in the community. We only have a few moments left. Our show is only 24 and a half minutes. I wish I had all day. Is there anything else that you specifically want to drive home for our listeners in reference to how they can reach out to you, who you serve, and what programs that you'd really like to see grow?
Well, obviously, I'd like to see the Upslide grow. It's just an amazing program. Please reach out to us at 772-469-2270 or on our website, which is www.seniorservicesirc.org. We serve all seniors in Indian River County and their loved ones, and trying to get them into services they might need. We do not do direct hands-on service to help people with things, but we refer them to those who do or can. Literally, give us a call. We're here to help. We work very closely. We are truly a collaborative. We work closely with all the agencies, including Senior Resource Association, Mental Health Collaborative.
I heard you mentioning some of them before, and they're all very respected organizations in our community. And I love that it's across the board that they're working together on something outside of their own initiatives, because the reality is that information is available and sometimes very easily available, but actually taking those first steps into gathering information is hard for many people. I know myself, I'm a procrastinator. I've got something on my list to do and I need to research it. It's probably not going to be the thing I do first thing in the morning.
Right.
So the fact that they can reach out to your organization and garner as much information from, like you said, from private care to home health to hospitals to rehabs to programs for initiatives for behavior and isolation and eliminating those things. I know that 2024 had a big movement in 2024 across the board nationally about isolation with our seniors. So this Upslide program, if you have a loved one who lives in Indian River County who's feeling a little lonely, consider giving them a call, because how many people are presently actively in the Upslide program?
So we have, we've probably got about 25 but not all of them come at the same time. We've got some that are in the process of coming on, and others that are in rehab or hospitals or things like that. So,
but that's still a really great group of people. And I see all the time on our social commentary and social media, people seeking that out. So thank you, Dawn, so much for coming and sharing about the collaborative, what you're doing, and why it's such a passionate program that you work with and support. And I thank you. I thank you and the collaborative for all you do here in Indian River County.
Thank you again.
And on that note, we are going to say goodbye today, but we will see you next week for more Silver Linings. Have a wonderful afternoon.